Hey guys, Liam here. It's day 3 post-op with my top surgery, my bilateral mastectomy with nipple grafts. So as far as progress, my drains are doing really well. Well, one of them is. The left one will most likely come out either later today or tomorrow. The right one's probably not going to come out till next week. As far as experience, pain-wise, I'm finding the only time I'm really excessively sore is after I've been sleeping, and that's usually when I've been sleeping longer than, what the pain meds will cover. Or I just been moving around a lot. I also have a cat that thinks that launching off of my chest when I'm sleeping is awesome. He's only done it a few times, but it's enough to make me not happy. Other than that, my garment is actually, it's not quite a vest, it actually has sleeves, and this is because I had a lot of excess skin, and he had to go pretty far back to remove the dog ears, so which we had discussed prior, and I knew that that's what was going to happen, and for me, I'd rather have the scars than have the dog ears, because they were so bad that it literally looked like they were like throwing up out of my binder. It was gross. Discomfort. A majority of my discomfort is the drains are actually about right here. They're not quite underneath my armpit, so they kind of right behind them is really itchy, and I think that's just mainly because it's a longer sleeves, my only concern about that is it's kind of upsetting because I can't really get in there to put, like, I've got some Gold Bond stuff that I was going to double as deodorant for now because I didn't really want to put anything that might irritate my skin on. However, with the long sleeves, it's hard for me to do that. I think today we're going to do maybe like a sponge bath type thing with some baby wipes, and maybe I'll be able to get my wife to put it on for me. So hopefully that'll work. I've been insanely itchy, like right across my chest, like not just underneath my armpits, but so I know that the healing process is going well. He's got me on antibiotics. I take them 4 times a day. They seem to be working really, really well. I'm finally able to sleep a decent amount. And crazy enough, I noticed this morning, now I don't know if it's actual or if it's phantom, but it's actually in, like this area where I believe my nipple is, around here, I actually am starting to have nipple sensation. And it's only the 3rd day after surgery, so, I don't want to get my hopes up, and at the same time, I don't, want to get too overly excited because I don't know if it's just a phantom feeling or if it's legitimately, I'm gonna have sensation. That's the one thing that, I didn't build myself up to, is I never let myself think, okay, well, I'm definitely gonna have sensation, because I know there's so many people who don't. So I'm hoping that I do, but if I don't, I don't. Other than the itching, the pain has come to, and the itching's it's crazy, but we did take a look. My wife did take a look at it and make sure that it's not red and irritated. So they basically have me taking a Benadryl once in a while to ease some of the itching. My concern is once in a while, sometimes when I use Band-Aids, the Band-Aid, if it stays on too long, will irritate my skin, so that's why I'm doing the Benadryl. I'm not necessarily allergic to medical adhesives, it's just sometimes they do, in fact, irritate my skin. Other than that, I did go home. I live about an hour from him. I should be able to head back down there at some point. I probably won't be driving still. I may be having someone hopefully take me down there. But I will definitely keep updates posted on what's going on. And as of right now, I am incredibly happy. I'm just getting a little moody because I can't do anything. I'm the type of person who likes to be completely independent, and having to wait for somebody to do something for you, especially when we have like a 1-year-old in the house that needs to be followed after all the time. So I kind of just have to wait, and sometimes get forgotten, and then I have a fit. But I overdid it on the second day. And I think that's why I'm having a lot of soreness and drainage on my right side, is because I did too much. So sometimes it gets to the point to where I can't really, it hurts just to move my arm because it's so sore. So all day yesterday I basically stayed in, I slept, I rested, made myself rest, and I'll probably do the same thing today, even though I don't really want to. Because honestly I'd rather have good results. Again, I can't say enough about Dr. Sassani. He's a really great guy. He has awesome bedside manner. Everyone in his office is phenomenal. You know, they've gone out of their way, bent over backwards, and it's not just you know, we want you to have this surgery. It's, they were behind me, you know, supporting me. There was an issue I don't really want to get too heavily into, but there was an issue because I was going to have it done at a hospital, which is close by him. However, there was a bit of an issue with the hospital, and they decided that I went in at like 9:30. I was supposed to go in at 10 for my surgery at 12. Well, they decided that they were going to come out to me at 10 o'clock and cancel my surgery at the hospital. Long story short, between the surgeon's staff and my insurance and everything, we managed, they got me back over to the surgical center, where his office is, and they actually did the surgery there. It took a lot of dancing, but it was able to be done. Honestly, I'm glad that I had it there. It was much more comfortable, you know, than a regular hospital setting. You know, everybody was great. The anesthesiologist was so awesome. I mean, I've had a bunch of IVs because I've been, you know, sick, and I've had surgery before. I mean, she numbed my arm before she put the IV in. I didn't even feel the IV. You know, so, and they do really do everything they can to make you feel comfortable. I mean, I honestly cannot say enough good things. And I mean, I'm not trying to be like, oh, this guy is the best, this guy is the one, this guy is the only. No, I'm just telling you, for me, from my experience, it was phenomenal. And it really made this day that was already extremely important to me that much better. You know, and I know everyone has a preference, you know, and I would never, you know, say anything bad about anybody else's choice, anybody else's surgeon. We all have to do what we have to do to make our journey work for us. But if you're looking for a surgeon that's in a great area, that has an excellent bedside manner, Dr. Sassani is phenomenal. And the best part is he's right by New Beginnings Retreat, which was another thing I stayed at a couple days, and there's guys like us there, healing with us. I mean, really? And the guy who runs it, he's had top surgery before. You know, he's also, you know, you can't get any better. I mean, the house is, like, huge. I mean, you have your own space, you got your own recliner in the room, your own TV, bed. I mean, I got one of those little husband pillows, a neck pillow. I mean, the first night I slept in a recliner because that's all I could do, but I'm telling you, with the kitchen, and there's like refrigerators and pantries, and I mean, if you forget something, they probably have it. They've got like teas, and in the bathroom, it's stocked with, like, I think mine had like Hibiclens and some shampoos and stuff that I didn't even think of, like drawers. In the drawers were like razors, and I mean, they make sure that you don't need anything, you know. Plus, you know, they take you out to grocery shopping. I know that they do like beach excursions, sometimes movies. I mean, it really is an awesome place. I mean, I can't say enough good things about it. But I'm going over time on my phone here, so it's going to tell me that I've got to turn it off. So I hope that this has been helpful. I will try to post another update when I have my first drain out, maybe get some video of the drain coming out. So stay tuned, and I will continue to vlog my experience with Dr. Sassani in Plantation. Thank you.